Speaker. Thank you, Mr Temporary Speaker. I rise on behalf of the Greens to address the Health Amendment Bill, and as we've heard today, there are a range of issues in the Health Legislation Amendment Bill which are obviously to be supported, which are welcome changes, and which I acknowledge the work of the Minister, her department and the staff involved in introducing these amendments. I did want to just spend a few minutes focusing on a particular section, just to outline some concerns and to ask for some clarification. In particular, I'm talking, Mr Temporary Speaker, about Schedule 3, Amendment of Private Health Facilities Act 2007 number 9. Mr Temporary Speaker, this element goes to the objective, which is in the current bill, to ensure that health services are viable, comprehensive and coordinated. And as you know, the proposal in this bill removes a section which the statutory review determined may lead to anti-competitive behaviour, and that is essentially the allowing of private facilities to be able to enter into the market, to allow private facilities to be able to compete against the public sector hospitals in particular circumstances. In the discussion, it's clear that the statutory review of the Private Health Facilities Act, it was tabled on the 18th of June 2013, it concluded that, quote, while the objective is valid, and that's the objective about viable, comprehensive and coordinated services, it has the potential to be anti-competitive, which may stifle new private health service initiatives, reduce innovation and efficiency in the health system, such a provision shouldn't remain. Mr Temporary Speaker, it is a concern that that statutory review did not include any public health representatives on it, and the concern is that the private sector had a larger voice and a voice that may have led to a situation which would undermine future planning of health. And this is my question, Mr Temporary Speaker. The government has gone on to say, and I noticed the Minister, even back in 2014 when the first legislation was introduced, said that there's other ways to assure appropriate oversight, and the Minister has gone through those ways. I won't repeat them, but in general it's about general market principles, comprehensive licensing, licensing standards, private health facilities having procedures to manage the transfer of patients and so on. But I would like to put to the House and request the Minister address the issue about the planned provision of health services, the concern that private health services might cherry-pick in higher socio-economic status areas, cherry-pick patients, which might lead to the public sector having to carry the weight, do the heavy lifting in lower income communities or communities which may not be seen as profitable. So that's a question that I ask the Minister to address, because of course the planning of health services is something which is a real struggle. I'm dealing at the moment, of course, like many of us, with the planning of schools, which is incredibly challenging, and making decisions about the planning of schools, trying to manage the public and non-government sector schools is often very challenging. In my own electorate, we've talked about healthcare issues. In my electorate, we have one hospital, Balmain Hospital. We had a 24-hour casualty service, which has now been reduced significantly, and we know it's doing great geriatric work. But that issue, Mr Temporary Speaker, about planned provision is really important. What steps has the government taken to address the potential impact on the planned provision of government services, of the provision of public health services, and is there any concern that the elimination of this provision would lead to any degradation of the provision of public service or have any impact on the provision of public services, because the existing provisions basically protect the public sector from private encroachment. So, Mr Temporary Speaker, that's my contribution to this debate. I think it's really important that we make sure that when it comes to the provision of health services, that the public sector continues. And I have to give the government credit, in terms of their investment in public health facilities. Of course, we have the staff and so on, that also need to be supported. In my electorate, we've seen a change in terms of the reduction in casualty service, but of course I also have RPA just next door to my electorate. So, what's that, RPA? Oh yeah, that's what I was about to say. She took the words out of my mouth. So RPA is right next to my electorate, and that's a hospital that does excellent work, and there's been some tremendous new facilities introduced at that site, and I'll be going over to one of the new facilities there in the coming weeks to have a bit of a tour. So, Mr Temporary Speaker, this question only about this provision I think is something we need to have on the record very clearly, that we'll be able to defend the public sector in terms of maintaining proper planning for health and not leading to a disjointed approach with private sector providers coming in and potentially affecting the way that we plan our healthcare system. So, Mr Temporary Speaker, of course we won't be opposing the bill, but we think that's a serious question that needs to be addressed. Thank you.